Thank you very much, Mr. Chairman. And before I ask the witnesses any questions, I wanted, since you're going to be leaving, to ask you a question. And I really do appreciate your having this hearing. Prescription drug prices is extremely important. Appreciate this, and it's an important topic. I will have questions. But you haven't yet scheduled a hearing on the Republican Trumpcare bill. I know you're a part of the discussion. You know what's in it. We have no idea. We haven't seen it. The people we represent don't have any idea. Senator McCaskill raised this at a hearing powerfully last week, and I want to raise it here too. Do you intend to have any hearings before the bill comes to the floor?
I have none planned, Senator Murray, but let me respond to that in two ways. One is that bill, if you're referring to the House bill, would be referred to the Finance Committee, not this committee. So you might take it up with Chairman Hatch. Well, number two, I had a hearing late January, early February. We had terrific witnesses. My hope was to focus on the individual market and changes that we might agree on in a bipartisan way. And most senators came to the meeting and made their Obamacare speeches that they've been making for the last 7 years. And I would summarize it by saying that the witnesses did very well at the hearing and the senators did very poorly. So if we're not able to focus in a bipartisan way when we have a bipartisan hearing, I don't think there's much promise for a bipartisan result, which leaves me to my third point, which is that this is a hearing that you ask for, correct, that other Democrats ask for, that Senator Cassidy and Republicans asked for. We agreed on who the witnesses should be. We have exceptional witnesses today. It's a chance to address drug pricing, which is important to every American family. And I would think that this committee is a group of grown-up adults who are able to do more than one thing at a time. And we can discuss Obamacare, if you would like. But today we're trying to discuss drug pricing, which is up to 15%. Well, you brought up the issue.
Ask you a question.
You asked me the question.
Absolutely.
about Obamacare, which is not the subject of today's hearing.
I
And if
agree.
that's the way you want to spend your time, fine. But that's, I mean, I don't know why I should call hearings requested by the Democrats with bipartisan hearings
Mr.
when you
Chairman,
won't focus on the hearing.
I appreciate that you're having this hearing. But I also would very much appreciate that we have a hearing on a bill that we are going to see that our folks have not seen, people across the country haven't seen. When we passed the ACA, we had 57 bipartisan help committee hearings and meetings and roundtables. So I will just say that that is disconcerting.
You passed the HCA in the middle of a snowstorm with 60 votes and crammed it down the throats of Republicans. And if you want to talk about that, we can. But today we're talking about drug pricing.
We are talking about drug pricing. It's an important part of the health care program, but I think people in the country are deeply worried about what is happening to the health care system.